result, teens should not be able to get cosmetic surgery. Confidence. Where does it come from? Does it come from the inside, the outside, or both? Teens probably think it all comes from the outside. What you wear, what you look like, the list goes on and on. In most cases, teens don't like their body and the way they look. A good percentage of them turn to cosmetic surgery. To teens, it seems like the easy way out. Some money, some stitches, and you're good. But that's not the truth. There's a lot of dangers, growth defects, and emotional connections. Cosmetic surgery is very dangerous. Some teenagers believe they need a procedure done to their body. But what they don't realize is that there's always a risk that something could go wrong and not end well. In the article, Too Young to Go Under the Knife, the author states, in Singapore, at least 2 people have died from a direct result of going under for cosmetic procedures. There are also lots of horror stories of procedures gone wrong, resulting in the patient looking worse than they did before the operation. Teens may not realize, but humans have an emotional connection to faces. Since they were born, they have been getting emotionally attached. According to someone who got a nose job, they say that people have an emotional connection, and even a slight change could be a long emotional journey, especially if you're too young. Teens getting cosmetic surgery is definitely not a smart thing to do. Along with the emotional connection, a teenager is still growing. In the article Adolescence, it states that puberty usually occurs from ages 11 to 14 and continues for 6 to 10 years. Teens are not done growing, which could result in moving of the implants and infections. Cosmetic surgery is definitely not worth your time, money, or life. There's a lot of dangers, growth defects, and emotional connections you should not have to deal with.
My opponent may say that, is this on? It says it's on.
Double click all the way over.
It is.
Then maybe it's just too far down. Yep, it's on.
Okay. My opponent may say that it is too early for teens to get cosmetic surgery. But we disagree. Put yourself in the victim's position. Pretend you're the one being pushed around and getting called bad names, being used or stabbed in the back. If it were you thinking of suicide thoughts, would it be too early then? Jill Mark's 11-year-old daughter, Julia, a rhinoplasty patient of Dr. Lucas's. She was 6 when she started going to the doctor. Her mother said, I would see her in the bathroom pushing her nose, trying to make it straighter. Kids would ask her, why is your nose so crooked? I did not want her to go through that. When you are saying it's too early for a teen to get cosmetic surgery, you're saying it's okay to just sit there and do nothing about what this child is going through and suffering with every day. When really, there was a perfect opportunity to help this teen feel confident in themselves, stop them from living an everyday nightmare, and most importantly, stop them from wanting to live at all. Would you rather risk a life or a nose job? Therefore, I think that both you and I can decide it's not too early for teens to get cosmetic surgery.
A variety of medicine that is this one? I'm sorry. Cosmetic surgery is a variety of medicine that is used to enhance the appearance through surgical and medical techniques. Cosmetic surgery can be performed on all areas of the head, neck, and body. When teens get cosmetic surgery, it helps fight depression, build self-confidence, and shows maturity. There are many reasons why teens should get cosmetic surgery. Some common types include rhinoplasty or nose jobs, cheek and chin enhancements, face, eyelid, neck, and brow lifts, and Botox. Botox is a drug that is used to remove wrinkles by temporarily paralyzing the facial muscles. Teens are drawn to cosmetic surgery because they may suffer with cancer, injuries, burns, diseases, or birth defects. But some do it for the reason of fitting in and looking acceptable to friends and peers. For whatever reason they are doing it, all teens struggle with their own insecurities. Although many people feel cosmetic surgery is not needed and they should deal with the problems they are facing, It is really hard for the person who's dealing with the problem, especially when they cannot control it. Cosmetic surgery is not intended to make people look better than others or to make them more popular. It is used to correct the body parts that have been damaged and to allow people to feel comfortable in their own skin. Teens stay up late doing homework, after school activities, and have the stress of friends, bullies, tests, good grades, teachers, and parents. They have enough stress on them already, and low self-esteem issues shouldn't have to be something to worry about. With cosmetic surgery, teens can focus on their future instead of something that lowers their self-esteem and makes them constantly feel bad. They could have been born with a feature that makes them self-cautious, but with cosmetic surgery, they can be confident and not afraid to be who they truly are. Feeling more confident in school can make them do better in class because they will be more focused, and I'm sure all teachers and parents want that. All in all, it is up to the patient and what they think is best for their body and what makes them most comfortable with themselves. I hope all teens strive to do what makes them most happy and the steps it takes to get there, no matter how hard it is along the way. Teens will not just think they look better on the outside, they will know they feel better on the inside. Thank you.
Cosmetic surgery, it could boost self-confidence in teens. According to the American Society of Plastic and Reconstructive Surgeons, more than 236,000 cosmetic procedures are performed on patients ages 19 and younger in each year. The number one reason is because they are insecure of their body image. We disagree with this. Teens should be happy with their image and love themselves for who they are. In the article, Seeking Self-Esteem Through Surgery, the author explains how even after surgery, most are still unhappy with the results. Some actually look worse than they did before the procedure. Therefore, even though surgery could boost self-confidence, I have shown that it is important for teens to love themselves for who they are and not for who they want to be. My opponent also says that it doesn't matter what age you need to be for a procedure and they're not too young. Teens and young children have surgeries done all the time. It won't hurt them. But we disagree. Age does matter. Teens are still growing and surgeries can hurt them. If teens get cosmetic procedures while they are still growing, there is a high risk of implants moving and not looking the way they should. The article Adolescence explains that teens are still growing from the moment they are born, from 6 to 10 years after puberty. This is significant because teens could have serious damage if they get surgery too young. Therefore, even though age may not seem to matter, teens should have to wait until a certain age or until they are done growing before they are allowed to sign up for risking their lives with a cosmetic procedure.